Welcome to all. Today we are going to discuss second part of identification of diarrhea and medicinal treatments. Evaluation of diarrhea. Evaluating diarrhea involves systemic approach to determine its cause and appropriate management. To evaluate diarrhea, check fever, check history, physical examination and associated symptoms, identify infectious or non-infectious diarrhea, presence of blood and mucus in stool. Check for fatty diarrhea, check for calprotectin, source or origin of diarrhea, increased fecal RBC, age of patients. First one, fever. Fever accompanying diarrhea can indicate an infectious or inflammatory processes. If fever greater than 38 degrees Celsius indicate infectious or inflammatory diarrhea. Next one, check history. Duration of diarrhea. If it is acute, less than 2 weeks. If it is persistent or subacute, 2 to 4 weeks. If it is chronic, greater than 4 weeks. Frequency, volume, consistency and sudden onset or gradual onset, it is also important. Find out recent travel, dietary history, medication use, medical history. Recent travel may lead to traveler's diarrhea. It is mainly infected with E. coli, Shigella, Salmonella, Campylobacter. Unfiltered water contacted with ill person may be lead to diarrhea. Undercooked meat, shellfish, egg, milk also lead to diarrhea. Admitted in a hospital may lead to diarrhea. HIV patients also lead to diarrhea. Reaction to toxins in fish, fungi, chemicals also lead to diarrhea. Next one is physical examination and associated symptoms. Physical examination, check for sign of dehydration. Abdominal examination for tenderness or distension. Distension is a viable swelling or enlargement of the abdomen. It is the sign of bowel obstruction. Associated symptoms, check for fever, abdominal pain, nausea and vomiting, weight loss, blood or mucus in stool. Persistent diarrhea greater than 7 days may be with Entamoeba histolica, Giardia, Cryptosporidium, Cyclospora, Isospora. The fever, bloody stool, abdominal pain, tenesmus mainly due to the infectious diarrhea. Abdominal pain, it is may be due to intestinal inflammation, increased motility, gas and bloating. Pain aggravated before meal, relieved with meal and incomplete evacuation, it is the sign of IBS. Intestinal inflammation. Bacterial, viral or parasitic infections can cause inflammation of the intestinal lining, lead to pain. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis cause chronic inflammation, often accompanied by abdominal pain. Increased motility. Diarrhea often involves increased contraction of the intestine, which can result in cramping and pain. Gas and bloating. Undigested food to ferment in the intestine, producing gas and bloating. Next one, muscle straining. Frequent bowel movements can lead to muscle strain in the abdominal wall, causing discomfort or pain. Next one, nerve responses. The intestines are sensitive organs. Inflammation and distension can activate pain receptors, leading to visceral pain, which may be felt as a cramping or sharp pain. Next one, radiating pain. Sometimes pain from the intestines can be felt into other areas of the abdomen due to nervous pathways, leading to referred pain sensations. Next one, nausea and vomiting. Nausea and vomiting accompanying diarrhea can be distressing and may indicate various underlying causes. First one, infectious causes. Gastroenteritis. Inflammation of the stomach and intestines due to viral or bacterial infections often lead to nausea, vomiting, and diarrhea. Next one, food poisoning. Consumption of the contaminated food can trigger a rapid onset of nausea, vomiting, and diarrhea as the body tries to expel the harmful agents. Increased intestinal motility, hyperperistalsis. Increased contraction in the intestine can lead to the rapid movement of contents, causing both diarrhea and nausea. It may be caused by some drugs. Next one, fluid and electrolyte imbalance. Dehydration. Loss of fluid through diarrhea can lead to dehydration, which may cause nausea and tendency to vomit. Next one, electrolyte imbalance. Significant loss of electrolytes can disturb normal body functions, lead to feelings of nausea. Toxins exposure. Toxins. Certain toxins from bacteria can lead to rapid nausea and vomiting often before diarrhea occurs. Next one, medication side effects. Antibiotics and other medications. Some medications used to treat underlying conditions can cause gastrointestinal upset, leading to nausea and vomiting. Chronic conditions like inflammatory bowel disease or pancreatitis can cause nausea and vomiting alongside diarrhea. Fourth one, identify infectious diarrhea or non-infectious diarrhea. Identifying whether diarrhea is infectious or non-infectious involves assessing several factors. First one, infectious diarrhea. It is caused by bacterial, viral, or parasitic infections. Symptoms like sudden onset, accompanied by fever, abdominal cramps, nausea, or vomiting. Check for blood or mucus in stool. Recent travel or exposure to contaminated food or water. Contact with someone who has diarrhea. Duration often lasts few days to week. Next one, non-infectious diarrhea. It may be caused by food intolerances, medication side effects, chronic disease like inflammatory bowel disease, irritable bowel syndrome, or stress. Symptoms like gradual onset may be persistent or chronic. Non-infectious diarrhea without fever or systemic symptoms associated with specific foods or medications. Duration can be longer lasting and may be require dietary changes or treatment for underlying conditions. Fifth one is presence of blood and mucus in stool. The presence of blood in stool during diarrhea may indicate various underlying conditions like infectious and inflammatory conditions. Infectious causes. Bacterial infections. Certain bacteria such as Shigella, Salmonella, and enterohemorrhagic E. coli can cause bloody diarrhea due to the inflammation and ulceration of the intestinal lining. Next one, parasitic infections. Some parasites like Endamoeba histolica can lead to bloody diarrhea. Next one, inflammatory conditions. Inflammatory bowel disease IBD conditions like Crohn's disease and ulcerative colitis often present with bloody diarrhea. due to chronic inflammation and ulceration of the gastrointestinal tract. Next one, diverticulitis. Inflammation of diverticula in the colon can cause bleeding, leading to bloody diarrhea. Bright red blood. It often indicates bleeding in the lower gastrointestinal tract, such as from hemorrhoids or anal fissures, but can also be sign of infections or conditions like diverticulitis or inflammatory bowel disease. Dark red or black stools may suggest bleeding higher up in the gastrointestinal tract, such as the stomach or small intestine. It is due to ulcer or certain cancers. If blood present in the stool, check colonoscopy or biopsy for the better identification. If no blood, may be feature of malabsorption, considered as a functional diarrhea. Avoid lactose and sorbitol in food. Next one, mucus in stool. Mucus alone can occur with mild infections or irritations. It may also be sign of conditions like irritable bowel syndromes or inflammatory bowel disease. Sixth one is fatty diarrhea. Fatty diarrhea, often referred to as a steatorrhea, is characterized by stools that are bulky, pale and foul smelling and may be float due to the higher fat content. Fatty diarrhea is a small bowel diarrhea. It is also identified by biopsy and imaging technique. Common cause of fatty diarrhea, pancreatic insufficiency, conditions like chronic pancreatitis or cystic fibrosis. It can impair the pancreas' ability to produce digestive enzymes. Celiac disease. It is an autoimmune disorder where the injection of gluten leads to the damage in the small intestine, affecting nutrient absorption. Next one, bile acid deficiency, condition affecting bile production or flow, such as liver disease or certain surgeries. Next one, infections. Certain gastrointestinal infections can lead to malabsorption, lead to fatty diarrhea. Next one, medications. Some medication can interfere with fat absorption. Seventh one is check for calprotectin. Calprotectin is a protein found in the white blood cells, and its presence in stool can be an indicator of inflammation in the intestines. Calprotectin, it is a marker of inflammation of intestine, IBD. Next one, TTG-IgA, tissue transglutaminase IgA. It is a type of antibody it produces in celiac disease. Testing for calprotectin is commonly used to help differentiate between inflammatory bowel disease and non-inflammatory conditions like irritable bowel syndromes. Eighth one is source or origin of diarrhea. First one is urgency. Low urgency in case of small bowel diarrhea and high urgency in case of large bowel diarrhea. Tenesmus, it means struggle and pain while excreting stool. It is more in large bowel diarrhea. E. coli mainly make small bowel diarrhea. Amoebiasis cause large bowel diarrhea. Mucus in stool in case of large bowel diarrhea. Dysentery, it means blood in stool. It's mainly caused by E. coli Shigella. In case of large bowel diarrhea, it show real blood color in stool. It is called hematochezia. In case of small bowel diarrhea, it shows coffee brown color blood. It is called melena, partially digested blood. Ninth one, elderly patients. Colorectal cancer. Blood in the stool can be a sign of malignancy in the colon or rectum, particularly in older adult or those who with risk factors. Next one is ischemic colitis. Reduced blood flow to the intestine can cause pain or bleeding, especially in older adults. Next one, differentiating features of chronic diarrhea. First one is secretory diarrhea. Secretory diarrhea caused by drugs, poisons, neuroendocrine tumors, lipoma, carcinoid tumors, and villus adenoma. There is no change or remain same while fasting. Second one is osmotic diarrhea caused by laxatives or non-absorbable carbohydrates like sorbitol, lactulose. There is no change or remain same while fasting. Next one, fatty diarrhea or steatorrhea. It is caused by malabsorption syndrome like indigestion and hyperthyroidism. There is a change or decrease while fasting. It also shows fecal fat present in the stool. Fourth one is inflammatory bowel disease. It caused by infection, ischemic colitis, radiation colitis, and neoplasia. Presence of fecal leukocytes, WBC, fecal RBC, fecal oculate blood. There is no change, remain same while fasting. Thank you for watching. Please watch next video for the medicinal treatments.